I'm pleased to be here with you to discuss a very important topic, respiratory illnesses in children that we commonly see in our outpatient settings. If you look at the general statistics world over, you will find that respiratory illnesses as well as different febrile illnesses are the commonest illnesses that are seen in outpatient departments for children. Okay, so there are different types of these respiratory infections in children. So there are those illnesses that will affect the upper airway, commonly the flus, the rhinitis, the allergies, the tonsillitis, and those are the very common ones that we see in our settings. Okay, then we go lower where you can have a tracheitis, those coughs that are hacky and painful, usually with a bit of blood. If the child is able to bring out the sputum, the older children, those are the kind we're talking about. We can have illnesses like bronchiolitis, bronchitis, and others that can even be chronic to the extent of tuberculosis. Broadly, when we are talking childhood respiratory illnesses, simply we shall say we have the pneumonia or the common cold, which broadly characterizes the upper respiratory infections, okay? And then we go to the pneumonia, you go lower into the lungs, where irrespective of what's causing it, you have a child who's coughing, has difficulty in breathing, and they are fast breathing with fever, but they don't have any danger signs. So the severe form of this pneumonia is where you have a child who is having a fever, they're having severe difficulty in breathing, failure to feed. Sometimes their lips turn blue, meaning they are not oxygenating well. Broadly, that's how we classify these respiratory illnesses in children. Broadly, these respiratory illnesses, majority that we see in our outpatient settings, are caused by viruses, okay? And one of the most common viruses is called the respiratory syncytial virus. So they normally cause very mild illnesses that are ideally self-limiting. But aside the viruses, we also have bacterial causes of these chest infections. And the most common within our setting, within school-going children, populations that are crowded, are strep pneumoniae bacterium. It's called Streptococcus pneumoniae. We have the fungal causes of respiratory illnesses like aspergillosis, not so common, but if you are around areas where they are farming, they use animal produce and all, they can be inhaled as spores. Child coughs for a long time, then before you know it, there's blood in there, okay? Especially for the older children. So other causes are those bacteria that are not so also common, yet very disturbing, like the Mycobacterium tuberculosis that causes TB. So that's one that we need to be very, very mindful about.